All right, chapter 5, even numbers. All right, here we go. 2 is true, 4 is false, 6 is false, 8 is true, 10 is false. 2 is false, 4 is true, 6 is true, 8 is true, and 10 is true. Key term assessment. 2 is J for jump. P is Q for queen. 6 is F for fun. 8 is H for hello. 10 is A for apple. 12 is M for mighty. 14 is N for no. 16 is C for cat. Word parts. Remember, you should have 2 answers. I'm only going to give you the meaning of the word part. 2, instrument used to measure. 4, a branch of medicine. 6, knowledge. 8, to view, to examine. All right. Evaluation of learning. 2, determine the patient's general state of health, arrive at a diagnosis and prescribe treatment, observe any change in the patient's illness after treatment has been instituted. Number 4, to assist the laboratory in correlating the clinical laboratory data with the needs of the physician. 6, acute illness is an illness characterized by symptoms that have a rapid onset, are usually severe and intense, and subside after a relatively short time. Examples include colds, influenza, strep throat, and pneumonia. Number 8, a therapeutic procedure is performed to treat a patient's condition with the goal of eliminating it or promoting as much recovery as possible. A diagnostic procedure is performed to assist in the diagnosis of the patient's condition. Number 10, to avoid mistaking one patient for another, if a procedure is performed by mistake on the wrong patient, the medical assistant could be held liable. Number 12, an empty bladder makes the examination easier and is more comfortable for the patient. Number 14, change in weight may be significant in the diagnosis of a patient's condition and in prescribing the course of treatment. 16A, the curvatures are the cervical, thoracic, lumbar, and sacral. B, the purpose is to increase the strength and resilience of the vertebrae column. 18, positioning facilitates the examination by providing better access to the part being examined. Draping provides for modesty, comfort, and warmth. Number 20, vaginal, pelvic, and rectal examinations. 22, makes mobility easier for individuals who cannot walk or are having difficulty walking due to illness or disability. Number 24, ask for assistance or notify the physician that it is not possible to make the transfer. 26, the physician documents findings from the physical examination into the computer, and the computer uses this information to generate a physical examination report. This eliminates the need to dictate the findings and transcribe them into a written report. 28, placement and size of organs, presence of any lumps, and existing of pain, swelling, or tenderness. 30. Listening to the heart and lungs, measuring the blood pressure using a manual sphygmomanometer. All right, very good. So make sure that you send me your results from Chapter 5 study guide, if what you missed or if you missed any. All right. So now we're going to go ahead and turn to our books to Chapter 6 on page 180. And really quickly, I wanted to also let you guys know, have any of you ever heard of a scribe?
Heard of it, but I really don't know what they do.
So I've had the opportunity to scribe for the last 4 years. And so if you can ever remember, or some of you may have, some of you may not, you ever remember you're seeing a doctor, like they talk into a little recording? That's what the dictating. They would basically translate the physical onto a tape recorder. They would send that to a transcriptionist who would type it up and then send it back, and then they would put that in the patient's chart. Well, now Scribe is the same thing, except it's a live person that sits there next to the doctor and types everything in for the doctor. Most of the time, as an MA, you can have the opportunity to do this. And basically, as an MA, while my provider is talking, I am typing every single thing he's saying. I'm in dermatology on the EMR that we used. You would just you would find the diagnosis and locate it, tap it to the right part of the body, put in any differential diagnosis that may be. Then you can go from prescribing for the patient, sending it out for the provider, and ordering tests. Like, it's everything that you can do. Like, you're basically in charge of that whole entire visit. So the only thing your provider has to do when he goes in there is he tells you what he thinks is going on and what the plan is, and then you put it into the system. It is really, really, it's really a lot of fun. It is challenging, and your anatomy and your terminology plays a big, big part in that. So, but if you're ever offered a chance to learn that, I recommend it. It's great. And then as a scribe, once you have some experience underneath your belt, you can scribe for anyone, even in the ER. So it's a lot of fun. All right, awesome. So let's go ahead and turn to page 180. Introduction to the eye. Chapter 6, Eye and Ear Assessment and Procedures. The medical assistant is responsible for performing a variety of assessments and procedures that involve the eye. Go ahead and highlight that first sentence. An understanding of the structure and function of the eye is essential to mastering skills in these areas. A visual acuity test is usually part of the routine physical examination. This test is a screening test to dictate deficiencies in vision. A visual acuity test, The medical assistant may also be responsible for assessing color vision with the use of specially prepared colored plates. As a result of this testing, color blindness can be detected. Color blindness is the inability to distinguish certain colors. The most common problem is with the colors red and green. Color blindness is particularly significant if the patient is involved in any activity that relies on the ability to distinguish colors, such as electronics or interior decorating. The medical assistant is responsible for performing or teaching the patient to perform eye irrigations and installations. Irrigation is washing a body canal with the flowing solution. Installation is dropping a liquid into a body cavity. Highlight those two sentences. Eye irrigations and installation should be performed using the important principles of medical asepsis outlined in Chapter 2. All right, Alicia, go ahead and read the first paragraph under the structure of the eye.
The eye has three layers. The outer layer is the sclera. How do you say that? Sclera?
Sclera.
Sclera? Okay. Which is composed of tough white fibrous connective tissue. The front part of the sclera is modified to form a transparent covering over the colored part of the eye. This covering is the cornea.
Very good. I want you to highlight that first paragraph. All right, Anna, go ahead and read the next paragraph, please.
Where it says the middle layer, correct?
Yes, ma'am.
The middle layer of the eye is the choroid, which is composed of many blood vessels and is highly pigmented. The blood vessels nourish the other layers of the eye, and the pigment works to absorb stray light rays. The front part of the choroid is specialized
Ciliary.
ciliary into the ciliary body. The suppository ligaments and the iris. The ciliary body contains the muscles that control the shape of the lens. The function of the suppository ligament is to suppend the lens in place. The lens is responsible for focusing the light rays on the retina. The color part of the eye is the iris, which controls the size of the pupil. The pupil is the opening in the eye that permits the entrance of the light rays.
Very good. Thank you. Okay, so you guys are going to want to highlight the lens is responsible for focusing the light rays on the retina. Jasmine, go ahead and read the next paragraph, please.
The third and innermost layer of the eye is the retina. Light rays come to a focus on the retina and subsequently are transmitted to the brain by way of the optic nerve to be interpreted.
Very good. Okay, you're going to highlight where it's the first sentence and then highlight where it says light rays come to a focus on the retina and subsequently are transmitted to the brain by way of the optic nerve. Lily, go ahead and read the next paragraph. Lily, can you hear me?
You said someone else. Okay, the anterior chamber is the area between the cornea and the iris, and the posterior chamber is the area between the iris and the lens. Both chambers are filled with a substance known as aqueous humor, the transparent jelly-like material known as vitreous humor fills the eyeball between the lens and the retina. Its function is to help maintain the shape of the eyeball.
Very good. Thank you. Natalie, go ahead and read the next paragraph.
The conjunctiva is a membrane that lines the eyelids and covers the front of the eye except the cornea. The conjunctiva covering the sclera is transparent except for some capillaries, which allows the white sclera to show through.
Very good. Okay, so I'm going to ask one question and I want to see if you guys are picking up by the time since we're in chapter 6. Out of that paragraph, What would you guys think would be probably pretty appropriate to highlight?
The conjunctiva is a membrane that lines the eyelids and covers the front
That's right.
of the eye. Okay.
Very good. Very good. All right. Let's see. Visual acuity refers to acuteness or sharpness of vision. Highlight that first sentence. A person with normal visual acuity can see clearly and is able to distinguish fine details close up and at some distance. Errors of refraction are the most common causes of defects in a visual acuity. Refraction refers to the ability of the eye to bend the parallel light rays coming into it so that they can be focused on the retina. Highlight that sentence. An error of refraction means that the light rays are not being refracted or bent properly and are not adequately focused on the retina. A defect in the shape of the eyeball can cause a refractive error. Errors of refraction can improve with corrective lenses. Hence, I'm wearing glasses. A person who is nearsighted has a condition termed myopia. Highlight that sentence. The eyeball is too long from front to back, causing the light rays to be brought to a focus in the front of the retina. A myopic person has difficulty seeing objects at a distance. Highlight that part. And may squint and have headaches as a result of eye strain. Corrective lenses, for example, eyeglasses or contact lenses, or laser eye surgery, can correct this condition, which then allows the light rays to come to a focus on the retina. All right. Sabrina, go ahead and read the next paragraph, please.
A person who is farsighted has a condition known as hyperopia. The eyeball is too short from the front to back, resulting in a different type of refractive error, in which the light rays are brought to a focus behind the retina. The individual has difficulty viewing objects at a reading or working distance. An individual with hyperopia may experience blurring, headaches, and eye strain while performing up-close tasks. Corrective lenses can correct this condition by causing the light rays to come to a focus on the retina.
Very good. So you're going to want to highlight where it says that a person who is farsighted has a condition known as hyperopia. And then I want you to highlight where it says individual has difficulty viewing objects at a reading or working distance. All right, Talia, go ahead and read the next paragraph, please.
Astigmatism is a refractive error that causes distorted and blurry vision for both near and far side objects. A normal cornea has a round or spherical shape and is smooth. With astigmatism, the cornea is curved into an oval shape. This causes light rays to focus on two different points of the retina instead of just one, resulting in disordered and blurred vision. Astigmatism often occurs in combination with myopia or hyperopia and can be corrected with the corrective lens.
Very good. All right, Alicia, go ahead and read that last paragraph, please.
Most people, a decrease in the elasticity of the lens of the eye begins to occur after the age of 40 years. The condition presbyopia
Presbyopia, yes.
results in a decreased ability to focus clearly on close objects.
Very good. Go ahead and highlight that last sentence. All right. Eye specialist. Anna, go ahead and read eye specialist for me.
If a defective individual activity is detected, the patient is referred to an eye specialist for further evaluation. Several types of specialists are involved in the care of the eye. The ophthalmologist is a physician who specializes in diagnosing and treating diseases and disorder of the eye. An ophthalmologist is qualified to prescribe optimal and systematic medication and to perform eye surgery. The optometrist
Tom,
is a licensed primary care provider who has experience in measuring visual acuity and prescribing corrective lenses for the treatment of refractive errors. An optometrist also is qualified to diagnose and treat disorders and diseases of the eye and to prescribe ophthalmological medication.
mhm,
An optometrist is not a physician and is not permanent to prescribe systematic medications or to perform eye surgery. The optician is a professional who inter- interrupts and fills prescriptions for eyeglasses and corrective lenses.
very good. Are you guys loving the words yet? Some doozies. Okay, so for eye specialists, you're going to highlight where it says an ophthalmologist is a physician who specializes in diagnosing and treating diseases and disorders of the eye. An ophthalmologist is qualified to prescribe ophthalmic and systemic medications and to perform eye surgery. And then I want you to highlight where it says optometrist is also qualified to diagnose and treat disorders and diseases of the eye and to prescribe ophthalmic medications. An optometrist is not a physician and is not permitted to prescribe systemic medications or to perform eye surgery. An optician is a profession who interprets and fills prescriptions for eyeglasses and contact lenses. Okay, so what is the difference between an ophthalmologist and an optometrist?
The ophthalmologist can do surgery.
Mm-hmm. Okay, and then so if you wanted to, so let's break it down. If you wanted to go to a provider for your eyes that can do everything, you would want to go to an what?
Ophthalmologist.
Yes. If you need one to just kind of take care of, I just want glasses or I need lenses, who could you go to?
The optician.
An optometrist. And then optician is one that
Just refills. Okay, I see.
yes.
I
So like
see.
then once you get your prescription, like I would take my glasses to Walmart and then I'm going to hand them to the lady who then returns and sends them to the optician. And they interpret that prescription and fills glasses or contact lenses, whatever's needed to be prescribed. All right, very good. Assessment of distance visual acuity. Myopia can be diagnosed in a combination with other tests by distance visual acuity (DVA) test. In the medical office, the Snellen eye chart is most often used. Highlight those last two sentences. Two types of charts are commonly used. One type is used for school-aged children and adults and consists of a chart of letters in decreasing sizes. The other type is used for preschool children, non-English speaking people, and non-readers. It is composed of the capital E in decreasing sizes and arranged in different positions. Highlight that. Visual acuity charts with pictures of familiar objects are available for use with preschool children. Testing with these charts tends to be less accurate than with the Snellen charts. Some children are unable to identify objects because of lack of recognition, not because of a defect in the visual acuity. It is suggested that the Snellen Big E chart be used with preschool children. All right, so now let's look at figure 6.3. And that is the Snellen eye chart. That is a very common one you will see. If you're dealing with pediatrics or even some family medicine, you'll also see figure 6.4 in your office. All right, conducting a Snellen test. Jasmine, go ahead and read the first paragraph, please.
The visual acuity test is performed in a well-lit room that is free of distractions. The test is usually performed at a distance of 20 feet. This can be conveniently marked off in the medical office with paint or a piece of tape so that it does not have to be remeasured every time the test is performed.
Very good. I want you to highlight where it says that the test is usually performed at a distance of 20 feet. Lily, go ahead and read the next paragraph, please.
Numbers separated by a line appear on the side of each row of letters on the chart. The numbers above the line represent the distance in feet at which the test is conducted. It is usually 20 feet because most eye tests are conducted at this distance. The number below the line represents the distance from which a person with normal visual acuity can read the row of letters. The line marked 20/20 indicates normal distance visual acuity or 20/20 vision. This means a person can read what he or she is supposed to read at a distance of 20 feet.
Very good. You're going to highlight that entire paragraph. Natalie, go ahead and read the next paragraph, please.
A visual acuity reading of 20/30 means this is the smallest line that the individual can read at a distance of 20 feet. People with normal acuity would be able to read this line at a distance of 30 feet.
Very good. You're just going to highlight that first sentence. Okay, so now does everyone kind of have an understanding of how the Snellen eye chart works? So if I say the patient reads results of 20 over 100, what does that mean for the patient?
One more time.
If I say that the patient reads at 20 over 100, what does that mean?
Be able to read at a distance of 100 feet.
Mm-hmm. Yes. If I say a patient reads at 2015,
They can read it from 15 feet.
that's right. All right. Any questions on that so far?
Would you use the second one, the one with the E's?
One more time.
How would you use the chart with the capital E?
Well, and that is actually what we're about to kind of go into. So you could, the way I've done it in the past is if your child is reading the E chart, you could have them go E, which means fingers are pointing this way. E, 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 E. So they can use it that way to identify what they're able to see. Because obviously you can't go E, 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 because that pretty much is a whole entire chart. So I normally would I'd ask the patients to point their fingers in the way the legs of the E are pointing. So it'd be this, 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 and you could have them go like this, 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 and you could have them do the whole entire chart that way. And that way you're actually, it's a little bit, you can identify with them better on what they're actually able to see clearly. All right, Sabrina, really quickly, I want you guys to go ahead and highlight on the last paragraph above assessing distance visual acuity in preschool children. Highlight where it says the patient should be instructed to leave open the eye not being tested because closing it causes squinting of the eye that is being tested. All right. Sabrina, go ahead and read the next paragraph, please.
Did I read that last paragraph that we just highlighted? Or
Yes.
okay. The acuity of each eye should be measured separately, traditionally beginning with the right eye. Most providers prefer that the patient wear his or her contact lenses glasses, except reading glasses during the test. The medical assistant should document the patient's medical document that I lost my place.
It's okay.
That corrected lenses were worn by the patient during the test. An eye occluder should be held over the eye not being tested. The patient's hands should not be used to cover the eye because this may encourage peeking through the fingers, especially in the case of children. The patient should be instructed to leave an eye open. To leave open the eye not being tested because closing it causes squinting of the eye that is being tested. The procedure for measuring distance visual acuity is outlined in procedure 6.1.
All right, very good. Yes. So normally, in most cases, your office will have a device, whether it is my mind just went blank. Whether it's the Oculander or another type of device, like even some providers will have them put on a patch. They'll wear one eye and one eye. Because most kids, they will peek through their hands, as my youngest has done that a couple of times. And so now I have her like close it and then I put my hand on it because she didn't want to wear glasses. And well, she needs glasses, so she would cheat on the eye test. All right, very good. Any questions on that? All right. Talia, go ahead and read the first paragraph for assisting distance visual acuity in preschool children.
With minor variations, procedure 6.1 can be used to test distance visual acuity in the preschool children. The Snell bid E-chart is used for this purpose.
Very good. Alicia, go ahead and read the next paragraph.
A child needs a complete and thorough explanation of what is expected of him or her before beginning the test. Tell the child you will be playing a pointing game. Do not force the child to play the game because the results then tend to be inaccurate. Draw the capital letter E on an index card and teach the child to point in the direction of the open part of the E by turning the card in different directions, up, down, to the right, and to the left. Using such phrases as fingers or the legs of the table to describe the open part of the E helps the child understand what is expected. Allow the child to practice the pointing game with the index card until you are sure the level of skill has been mastered. Be sure to praise the child when the correct response is given. The child might need to keep holding the eye ocular, I don't know, in place. The aid of another person, such as the parent, would then be required. I just read the rest because it was short.
It's okay. All right, very good. So now assessment of near visual acuity. Anna, go ahead and read. Go ahead and read the first and second paragraph.
Near visual acuity testing assesses the patient's ability to read close objects. Example at the reading or working distance. The test results are used to detect hyperopia and presbyopia. The test is conducted with a card similar to the Snellian eye chart. However, the size of the type range from the size of newspaper headlines down to considerably smaller print, such as would be found in a telephone dictionary. Figure 6.6. The test card is available in a variety of forms, such as printed paragraphs, printed words, and printed pictures.
Very good. So you're just going to highlight that very first part, very first sentence on the first paragraph. Jasmine, will you go ahead and read the next paragraph, please?
The test should be performed in a well-lit room free of distractions. It is conducted with the patient holding the test card at a distance between 14 and 16 inches. If the patient wears reading glasses, they should be worn during the test. The acuity should be mastered in each eye separately, traditionally beginning with the right eye. An eye ocular should be held over the eye not being tested. The patient should be instructed to keep the covered eye open because closing it may cause squinting of the eye that is being tested. The patient is asked to read or identify orally each line or paragraph of type. During the test, the patient should be observed for unusual symptoms such as squinting, tilting the head, or watering of the eyes, which may indicate that the patient is having difficulty reading the card. The patient continues until reaching the smallest type that can be read.
All right, very good. So the only part you're going to highlight is where it says it is conducted with the patient holding the test card at a distance between 14 to 16 inches. All right, let's go on over to page 184. So figure 6.6. So this is an example of the NVA card. And you basically would just have the patients read it just like you would do a Snellen chart, and then you would document, okay, left eye read, number 4.75, right eye, number 8, 1.75. All right, the results are documented as the smallest type that the patient could comfortably read with each eye at a distance at which the card was held, for example, 14 to 16 inches. The documentation is based on the type of test card used to conduct the test. One type of card uses a documentation method similar to that used with the Snellen eye test. For this type of near visual acuity card, the results would be documented as 1414 for a patient with normal near visual acuity. This means the patient read what was supposed to be read at a distance of 14 inches. Also included in the documentation should be the date and time, corrective lenses worn, and any unusual symptoms exhibited by the patient. Assessment of color vision. Defects in color vision may be classified as congenital or acquired. Congenital defects are more common and refer to a color vision deficiency that is inherited and is present at birth. Congenital color vision deficiencies most often affect males. Highlight those last two sentences. Acquired defects refer to a color vision deficiency that is acquired after birth, resulting from such factors as an eye or brain injury, disease, and certain drugs. Color vision tests, such as the Ishihara test, detect congenital color vision disturbances and are commonly performed in the medical office. A basic screening for color vision can be performed by asking the patient to identify the red and green dots on the Snellen eye chart. The Ishihara test for color blindness is a convenient and accurate method to detect total congenital color blindness and red-green color blindness by assessing an individual's ability to perceive primary colors and shades of color. The Ishihara book contains a series of polychromatic plates of primary colored dots arranged to form a numeral against a background of similar dots of contrasting colors. See figure 6.7. Patients with normal color vision are able to read the appropriate numeral. However, patients with color vision defects read the dots either as not forming a number at all or as forming a number different from the one identified by the individual with normal color vision. The first plate in the Ishihara book is designed to be read correctly by all individuals with normal vision and exhibiting color vision deficiencies, and should be used to explain the procedure to the patient. The book includes plates with winding colored lines for patients who are unable to identify the numbers by name, such as preschool children and non-English speaking people. The patient should be asked to trace a line formed by the colored dots using a cotton swab or the eraser end of a pencil. The patient's fingers should not be used to do the tracing because over time soiled fingers can degrade the polychromatic plates. The Ishihara test should be conducted in a quiet room illuminated by natural daylight. If this is not feasible, a room lit with electric light may be used. However, the light should be adjusted to resemble the effect of natural daylight as much as possible. Using light other than just described, such as bright sunlight, may change the appearance of shades of color on the plates, leading to inaccurate test results. Okay, so let me just go and finish reading it. The medical assistant is responsible for performing the color vision test and for documenting results in the patient's medical record. The provider assesses the results to determine whether the patient has a deficiency in color vision. The Ishihara test consists of 14 color plates. Plates 1 through 11 are used to conduct the basic test, and plates 12, 13, and 14 are used to further assess patients who exhibit a red-green color deficiency. Highlight that last sentence. It is unnecessary to include these plates 12, 13, and 14 in the test of patients who exhibit normal color vision. In interpreting the results, if 10 or more plates are read correctly, the patient's color vision is considered normal. If 7 or fewer of the 11 Ishihara plates are read correctly, the patient is identified as having a color vision deficiency. It would be unusual for the medical assistant to obtain results in which the patient has read 8 or 9 plates correctly. The test is structured so that a patient with a color vision defect typically does not read 8 or 9 plates correctly and the rest incorrectly. If a defect in color vision is detected, the patient is referred to an additional assessment of color vision to an ophthalmologist or optometrist, who would use more precise color vision test. The procedure for assessing color vision using the Ishihara color plates is outlined in procedure 6.2. Okay, so really quickly, let's go back to page 185. We have our first case study. Nicole Deason brings her daughter Haley to the office for a camp physical. Haley has just completed the 4th grade and is going to summer camp for 2 weeks with Tess, her best friend. Tess wears glasses and Haley thinks they are really cool. She often asks to try on Tess's glasses and wishes she could wear glasses just like her best friend. When Haley is measured for visual acuity, she misses a few letters on the 2070 line, the 2050 line, and the 2040 line, and the 2020 line. She is unable to read any of the letters on the 2015 line. After the examination, Haley wants to know if she missed enough letters to be able to get glasses. Okay, so first things first, what would you do? Anybody?
Well, she's obviously lying. I mean,
Yes, very good. Okay, so what would be a way that you could communicate with Haley to make sure she's understanding why she's having to do this?
What was that question again?
What would be a way that you could communicate with Haley so that she understands why she's having to do this test? Since I agree, it looks like she's lying because she wants glasses. So how can we communicate so she understands why she's having to do this? Retest her, yes.
Tell her why people need glasses, and
Yep,
if I'm guessing like when you do wear glasses when you actually don't need them, doesn't that mess up your vision as well?
that's right. It can, because you're adding strain to your eyes that they don't need. So, that's going to actually cause more problems. Sorry. Very good. Okay, so any other ideas? Sabrina, that's right. Tell her why people need glasses. Okay, well then let's switch it around. What would you not do for Haley?
not just go with her saying, "Hey, did I miss enough to get glasses?"
Yep, very good. What's another thing we're not going to do?
Glasses.
Yes. What would be something else?
Some inmates kind of like get frustrated, so
Yeah,
you don't want to make it seem like you're frustrated with her.
right. Yeah, we don't want to come across as, Haley, we know you're lying. Stop lying. We don't want to do that, because then that's where we're going to lose that relationship with our patients. So we're not going to get her in trouble because she's, doing her best to achieve wearing glasses. So very good. Okay, good. All right, so let's go to page 186. So figure 6.7. Have any of you guys seen the Isahara color plates, or maybe you have and you didn't realize that's what that was? So this is a very, very common test. I have to get it done every 6 months.
I've gotten it done for a job, like a physical examination. I had to get one of these.
That's right. Yep, it's part of a physical examination. Very good. For me, because of medicine that I take, side effects is that it can affect your eyes. So I have to go and do this test and my eye test every 6 months. And yeah, some people have never had to see these, and I mean, because it's common, but it's not common. I mean, if you've never really had to get your eyes checked, or you never had problems with your eyes, you probably would not have come across this. All right, very good. So really quickly, I want you guys to turn to page 188. On the number 3 procedural step, highlight where it says, tell the patient that 3 seconds will be given to identify each plate. On page 189, on procedural step 8, I want you to highlight the procedural step and the principle. All right, and then we're going to go on to page 190, eye irrigation. An eye irrigation involves washing the eye with a flowing solution. Eye irrigations are performed for the following purposes: to cleanse the eye by washing away foreign particles, ocular discharges, or harmful chemicals, to relieve inflammation through the application of heat, and to apply an antiseptic solution. Procedure 6.3 shows how to perform an eye irrigation. All right. So I want Jasmine, will you please go ahead and read the eye installation?
An eye installation involves the dropping of a liquid into the lower conjunctival sac of the eye. Eye installations are performed to treat eye infections with medication, to soothe an irritated eye, to dilate the pupil, and to anesthetize the eye during an eye examination or treatment. Medication to be instilled in the eye may come in the form of a liquid, an ophthalmic drops, or as an ophthalmic ointment. Eye drops are usually dispensed in a flexible plastic container with an attached dropper. Eye ointment is dispensed in a small metal tube with a small tip for applying the medication. Procedure 6.4 shows how to perform an eye installation.
All right, very good. So you're going to want to highlight the second sentence where it says eye installations are performed to treat eye infections. All right, case study number 2. Peter Mitchell comes in with his 5-year-old son, Clive. Clive is diagnosed with conjunctivitis, pink eye, and the physician prescribes Polytrim ophthalmic suspension. Mr. Mitchell says that Clive does not cooperate very well when having drops put in his eyes and asks for any ideas that might make it less of an ordeal. Mr. Mitchell has 7-year-old twin girls at home and wants to know what can be done so they don't get pink eye. He asked if it would be all right to install the drops in the twins' eyes as a preventative measure. All right, what would you do?
What is the suspension? What is that?
It is a common antibiotic.
So it's a prescription.
Yes.
Okay. So I can't share. They obviously can't do that. So
That's
I was
right.
saying because maybe if it was like saline or something, it wouldn't be that big of a deal. But if it's the prescription, no.
Right. So what would be, because just like if we take oral antibiotics, you don't want to take something preventative if it's not needed. So what would be something that we could advise Mr. Mitchell to do for the twins?
I mean, just to make sure that Peter washes his hands and doesn't touch his eye, and then touch his sister or touch things that his sister's going to use.
Yeah, very good. So would the twins need to do the same thing?
Yes.
Yes, that's right. I would have them all, just like pretend pink eye is COVID. We're going to wash our hands. We're not going to touch. If Clive uses a washcloth or a towel, we're not going to let anybody else use it. We're going to go in and wash it. things like that. All right, good. So is there anything else that we could offer? What about suggestions on how Mr. Mitchell can get the eye drops into Clive, since Clive does not like getting eye drops? And I can't really say I don't blame him. I'm not a big fan of it either. So what would be something that we could advise Mr. Mitchell to do?
He could reassure him that it'll help his eye get better
Yeah,
if he takes his medicine.
yeah, that's true. All right, what else? So one thing that you can do, and I actually do this myself because I don't like anything going in my eye. That's why I don't wear contact lenses. Ugh, creeps me out. Okay, so you could tell Mr. Mitchell to have Clive lay down flat, close his eyes, and put the drops on this side, on the inner part right next to the nose, and just let it sit there. And then have Clive open his eyes. And then what's going to happen is that solution's going to go into the eye when he opens it. And then that way, Clive is not actually seeing the drops go into his eyeball. All right, awesome. Very good. So now go ahead and turn to page 192. Any questions about anything so far? Okay. So on page 192, I want you guys to highlight the second sentence in number 8 procedural step. Gently release the solution onto the eye at the inner canthus. All right, on page 193, on number 7 procedural step, on the first bullet point, eye drops, you're going to highlight the last 2 sentences. Gently squeeze the container and place the correct number of eye drops in the center of the lower conjunctival sac. Never place the drops directly on the eyeball. Replace the cap on the container. So why would we not want to place drops directly on the eyeball? Does anybody have an idea why?
Contamination.
Yes. Yep. That's why we also don't want the top of the dropper to touch anything around the eye, because we're basically just recontaminating it. Very good. All right. On page 194, on procedural step 6.4, on that picture, right underneath that picture, I want you to highlight where it says ask the patient to look up. All right, so that is the eye. Any questions about the eye? Okay, now it's time to go on to the ear. Let's see. Jasmine, go ahead and read the first and second paragraph, please, for introduction to the ear.
The medical assistant is responsible for performing a variety of procedures that involve the ear. An understanding of the structure and function of the ear is essential to mastering skills in these areas. Hearing tests also may be part of the routine physical examination. During contact with the patient, the medical assistant should be alert to signs that indicate the patient might be having difficulty hearing what is being said. A whispered voice next to the patient's ear can be a screening test for hearing acuity. The use of tuning forks or an audiometer provides a more accurate determination of hearing acuity. An audiometer is an instrument that emits sound waves at various frequencies. The patient is instructed to indicate when a sound at a given frequency can be heard.
Very good. Okay, guys, so out of those 2 paragraphs, what would be something that you would think I would tell you to highlight?
The audiometer is an instrument that emits sound waves at various frequencies.
Very good. And go ahead and highlight that next sentence as well. All right, Lily, go ahead and read the next paragraph, please.
The medical assistant is responsible for performing or teaching the patient to perform ear irrigations and installations. Irrigations and installations should be performed using the important principles of medical asepsis outlined in Chapter 2.
All right, very good. Okay, so when we covered the eye part, we heard the words eye irrigations and eye installations. So what does that mean the ear irrigations and the ear installations might involve?
Flushing the ear?
Yes. And what else? Putting solutions in the ear. So irrigation is going to be flushing, just like the eyes, and installation is going to be where we're putting something into the ear. All right, very good. The ear functions in hearing and in maintaining equilibrium. It consists of 3 divisions: the external ear, the middle ear, and the inner ear. The structures in the ear are illustrated in figure 6.8 and are described next. The external ear is composed of the auricle or pinna and the external auditory canal, also known as the external ear canal. The opening into this canal is the external auditory meatus. The auricle is a flap of cartilage covered with skin that protects from the inside of the head. Its function is to receive and collect sound waves and to direct them toward the external auditory canal. Highlight those 2 sentences. The external auditory canal is approximately 1 inch long in an adult and extends from the auricle to the tympanic membrane. It is lined with skin that contains fine hairs, nerve endings, and glands. The glands secrete earwax or serum, a yellowish, waxy substance that lubricates and protects the ear canal. Highlight that last sentence. The canal has an S-shaped curve as it leads inward. The canal must be straightened during examination with an otoscope, ear installation or irrigation, or oral temperature measurements. The tympanic membrane is at the end of the external auditory canal. It is pearly gray, semi-transparent membrane that receives sound waves. Highlight those last 2 sentences. The middle ear is an air-filled cavity that contains 3 small bones, or ossicles: the malleus, the incus, and the stapes. The eustachian tube connects the middle ear to the nasal pharynx. Highlight that sentence. Air pressure between the external atmosphere and the middle ear is stabilized through the eustachian tube. The inner ear contains cochlea, which is the essential organ of hearing. The semicircular canals are also are located in the inner ear and help to maintain equilibrium. Highlight that last 2 sentences. All right, any questions about that so far? All right, really quickly, I want you guys to write down the following. And you're going to keep this as your notes to study. Okay. AU is both ears. AS, left ear. AD, right ear.
was the second one again?
OU, both eyes. OD, right eye. And OS, left eye. Okay. Assessment of hearing acuity. Lily, go ahead and read the first and second paragraph, please.
The assessment of hearing acuity is an integral part of the complete physical examination. It is possible for an individual to have hearing loss and not be aware of it. Early detection and treatment of hearing problems help prevent permanent hearing loss. An individual with normal hearing should be able to hear the frequency of normal speech, which ranges from 300 to 4,000 hertz, or cycles per second, at a normal sound intensity. Patients who exhibit hearing loss are referred to an otolaryngologist or an audiologist for further evaluation.
Very good. Okay, so I want you guys to highlight on this second paragraph where it says an individual with normal hearing should be able to hear the frequencies of normal speech, which range from 300 to 4,000 hertz. All right, so let's go and read our case study number 3. Willow Basil brings in her 6-year-old daughter, Jade. For the past 3 days, Jade has been running a fever and has had persistent pain and hearing loss in her left ear. Ms. Basil practices alternative medicine and uses prescription medications as little as possible. She says that she's been trying herbal therapy and aromatherapy to make Jade better, but it does not seem to be helping. Jade is diagnosed with acute otitis media, and the physician prescribes amoxicillin for 10 days. Ms. Basil wants to know if she has to give Jade the amoxicillin for the entire 10 days. She asks if she can stop using it when Jade starts feeling better. Ms. Basil also wants to know if the ear infection will cause a permanent problem with Jade's hearing. Okay, so I'm sure if you don't already know, this is a really big common one. So let's first start with what would you do?
Explain to her that it's important that she finishes her medication because then she could, like relapse, like get it again. You know what I mean?
That's right. So it is very common for people with antibiotics to stop taking it because they start feeling better. But what happens is that infection that they were treating it for will come back. But when it comes back, because you didn't complete that full cycle of antibiotics, that infection can become um, my mind is going blank a lot this morning. The medicine that they took is not going to be, it's not going to help them because now that infection is resistant to that medication. So then you have to switch to another medication to treat it. All right, very good. So what else could we do? Any ideas? You're super quiet today.
you guys already said about the prescription, right? That it's important for her to take it 10 days because if not, her body can get immune to it.
Yes. Very good.
And I mean, you could tell her that she could give her something for the fever as well if it gets higher.
Very good. Very good. Okay, what else? All right, well, let me ask this. So the mom says that she practices alternative medicine. She uses herbal therapy and aromatherapy. So as a medical assistant, what do we need to make sure that we do?
To kind of remind her that some people are allergic to that. So you have to kind of like watch what you're doing because she could be allergic to anything that she's using and not know it.
That's true. That's a good point. Very good. Okay, what else? I'm looking for something particular.
Depend on what she's using. Can't that make the ear infection worse?
Not necessarily, but you're kind of on the right track. So even if it's herbal therapy, aromatherapy, over the counter, I don't care if it's Tylenol, we need to document what this patient has been given because some things, even herbal and aromatherapy, can cause a conflict with the medication that the doctor may be wanting to prescribe. So if you come across a similar situation, go ahead and document what they're using. I don't care if it says, well, it's just, herbal therapy. That's fine, not a problem. I just want to make sure we have everything in the chart so the provider can prescribe a more accurate treatment plan for the patient. Okay. Now, you are going to come across, and personally, I have nothing against herbal therapy, aromatherapy. I think a little bit of everything probably helps in a way. Talk to the physician. That's right, Sabrina. So let the physician know as well. And then we're going to go ahead and advise the patient that, I'm not sure if we're not going to give them our opinion on what the mom is doing. We just want to make sure we document it and we'll make sure that the physician knows because you'll come across this a lot. A lot of parents, they don't believe in giving their kids medications and for their own reasons. We're not here to judge. That is not our job. All right, very good. All right, Natalie. Go ahead and start reading types of hearing loss. It's a big paragraph. Natalie. All right, Sabrina, go ahead and read the next paragraph, please.
There are three types of hearing loss: conductive, sensorineural, and mixed. Conductive hearing loss results when there is physical interference with the normal conduction of sound waves through the external and middle ear. Because of the interference, the amount of sound reaching the inner ear is less than normal, resulting in hearing impairment. Conductive loss is the external ear may be caused by an obstruction in external ear canal, such as swelling from external otitis, foreign bodies, benign growth such as polyps, and impacted cerumen. Cerumen? I don't know.
Serum.
Serum?
Uh-huh.
Okay, refers to cerumen that is wedged firmly together in the ear canal so as to be immovable. Conductive loss is in the middle of the ear may be caused by serious otitis media or acute otitis media, a perforated tympanic membrane or otosclerosis. The cause of conductive hearing loss is often can be detected by examining the external ear canal with an otoscope. Hearing is frequently restored by removing the obstruction or treating the disorder.
All right, very good. So on page 195, I want you guys to highlight the second sentence. And on page 196, you're going to highlight where it says a conductive loss in the middle ear may be caused by a serious otitis media. All right, Talia, go ahead and read the next paragraph, please.
Sensorineural hearing loss, SNHL, results from damaging the inner ear or auditory nerve. With this type of hearing loss, sound is conducted normally through the outer and middle ear structures, but because of the problem with the perceptions of sound waves, a hearing deficiency occurs. Suspected causes of sensorineural loss includes hereditary factors, degenerative changes from the normal aging process known as what's that?
Presbycusis.
Presbycusis, intense noise exposures over time, tumors, toxicity caused by certain medications and infectious diseases such as measles, mumps, and meningitis. The most common cause of sensorineural hearing loss is in adult and what's that called again?
Presbycusis.
Presbycusis. An individual age, nerve, and sensory respiratory cells in the inner ear deteriorate, leading to a gradual loss of hearing. Mixed hearing loss is a combination of conductive and sensorial loss, usually because of these frequencies falls within the range of normal speech. The Weber and Rain tests are in the tuning fork tests most commonly performed by the provider. They are used to identify conductive and sensorial hearing loss.
Very good. Okay, so you're going to highlight the first sentence. And then I want you to highlight where it says that specific causes of sensorineural loss include hereditary factors, degenerative changes from the normal aging process known as presbycusis, intense noise exposure over time, tumors, ototoxicity caused by certain medications, and infection disease such as measles, mumps, and meningitis. Okay, so my husband, he does, what? He can't hear. What do you think would be a common, after what we just read, a common reason why he does not hear as good as he did 5 years ago? And I'm guilty of doing this too.
That P word.
Presbycusis, that's right. So growing up, if the whole neighborhood didn't hear my music, it wasn't loud enough. So when you're driving down the road, you turn your music up really loud or even on your headphones. Well, it doesn't bother you at that moment. But 15 years later, you can't hear that good. My husband is a result of that. And if I could ever go get him to get his hearing checked, it'd be great. But he refuses. All right, very good. Any questions about that? Nope. All right. Alicia, go ahead and read hearing acuity test.
Numerous tests can be used to assess hearing acuity. Tests range from the simple gross screening test to qualitative tests using a tuning fork to highly specific quantitative. I can't even say that right now. Quantitative test using an audiometer.
Yep, very good.
It is important to test only one ear at a time because a hearing deficit can exist in one ear only. The ear not being tested should be blocked by an earplug or mask. Masking involves the presentation of sound, usually noise, to the ear not being tested, so that the patient's response is based only on the ear that is being tested.
Very good. Anna, go ahead and read gross screening test.
The gross hearing test is a simple, quick screening test used to identify a large hearing impairment. The provider performs the screening test during the physical examination. Hearing is assessed by asking the patient to repeat a simple word or series of numbers whispered from a distance of 1 to 2 feet from the ear. When a hearing loss is discovered, a tuning fork or audiometer is used for a more persistent, precise assessment for hearing.
Awesome, very good. Okay, Lily, go ahead and read the first paragraph on tuning fork test.
Oh, never mind. Tuning fork tests provide a general assessment of hearing acuity and may be part of the physical examination. A tuning fork with a frequency of 512 Hz or 1024 Hz is usually used because these frequencies fall within the same range of normal speech. The Weber and Rene tests are tuning fork tests most commonly performed by the provider. They are used to identify conductive or sensory-neutral tests. Hearing loss.
All right, very good. Okay, so the Weber test is a useful assessment of hearing loss when one ear hears better than the other. Go and highlight that. The tuning fork is set in vibration, and the base of the fork is placed on the center of the patient's head. The patient is asked to indicate where the sound is heard best. The patient with normal hearing would hear the sound quality in both ears or in the center of the head. Figure 6.9 illustrates the Weber test and describes the interpretation of results. The Rhine test compares the duration of sound perception by air conduction with that of bone conduction. The tuning fork is set in vibration, and the base of the fork is placed against the bone of the mastoid process. The patient is instructed to indicate when the sound is no longer heard. The prongs on the fork, still vibrating, are placed in the air about 1 inch from the opening of the patient's ear canal, and the patient indicates when the sound is no longer heard. An individual with normal hearing is able to hear the sound at least twice as long through air conduction as through bone conduction. Figure 6.10 illustrates the Rhine test and describes the interpretation of results. All right, so really quickly, let's look on page 197. So figure 6.9 is the Weber test. And 6.10 is how you would do the Rhine test. Any questions about that? All right, good. Audiometry. Sorry. Odometry. I knew that one, it didn't sound right. Odometry is a measure of hearing acuity using a special instrument called an audiometer. An audiometer quantitatively measures hearing for the various frequencies of sound waves. Audiometry is more specific hearing acuity test because it provides information on how extensive a hearing loss is and which frequencies are involved. Highlight that sentence. It is important that the test be conducted in a quiet room because outside noise may affect the results, especially in the lower frequencies. The patient wears headphones placed snugly over the ears. The audiometry delivers a single frequency at a time at specific intensities, starting with low frequency tones from 250 to 500 hertz and going to very high frequency of 6,000 to 8,000 hertz. The patient is asked to signal when he or she hears a sound so a patient's hearing threshold for each frequency can be determined. The hearing acuity in each ear is assessed separately, and the results are plotted on a graph known as an audiogram. The medical assistant may be responsible for performing audiometry in the medical office. Before operating an audiometer, however, the medical assistant must receive extensive on-site training from an audiologist to ensure that proper technique is used to conduct the test. That's okay, Natalie. Tympanometer. Tympanometer is not a hearing test, but it does help determine the cause of hearing loss. So it is presented in this section. The tympanometer consists of an earpiece attached to an electronic device. The earpiece is placed snugly in the patient's ear, and low frequency sound waves are directed against the eardrum, while pressure is applied in the ear canal. With a normal ear, the eardrum exhibits mobility in response to the pressure, as indicated on the graphic readout known as a tympanogram. If there is fluid in the middle ear, the eardrum does not move but remains stiff, as indicated on the tympanogram. Tympanometer is useful in diagnosing serous otitis media, fluid in the middle ear, which is a common cause of temporary hearing loss in children. I want you to highlight where it says the tympanometer is useful in diagnosing serous otitis media, fluid in the middle ear. All right, ear irrigation. Ear irrigation is the washing of the external auditory canal with a flowing solution. Ear irrigations are performed for the following purposes: to cleanse the external auditory canal, to remove serum, discharge, or a foreign body, to relieve inflammation by applying an antiseptic solution, and to apply heat to the ear. Before irrigating, impacted serum must be softened by installing warm mineral oil or hydrogen peroxide for 10 to 15 minutes. An ear irrigation should not be performed if the tympanic membrane is perforated, because this could result in severe irritation or infection of the middle ear. Ear irrigations are most commonly performed in the medical office using either an ear irrigating syringe or an elephant ear wash system. Procedure 6.5 shows how to perform an ear irrigation. Use both of these methods. The elephant ear wash system is the most common one now. And I used to love doing this. The things that you get out of people's ear is surprising. All right, ear installation. An ear installation involves dropping a liquid into the external auditory canal. Ear installations are performed to soften impacted serum, to combat infection with the use of antibiotic eardrops, and to relieve pain. Highlight that sentence. The eardrops are usually dispensed in a flexible plastic container with an attached dropper. Procedure 6.6 shows how to perform an ear installation. So when you're going to irrigate the ear, you actually have to do a little bit of both. Not only the irrigation, but the installation, because we have to soften up anything that's impacted. So you actually have to put something in the ear and then flush it out. All right, make sure you highlight where it says ear installations are performed to soften impacted serum, to combat infection with the use of antibiotic eardrops, and to relieve pain. All right, I want you guys to go on over to page 202. I want you to highlight number 8, procedural step. And on number 10, I want you to highlight the principle where it says the tip of the irrigating device should be directed at the roof of the canal to prevent injury to the tympanic membrane. On page 204, you're going to highlight number 9, procedural step, and principle on number 9. Okay, so before we go on to the next thing, make sure that you read the procedures, the case studies, all the figures on chapter 6, and the terminology. And then I want you guys to go ahead and turn to your binder, to your chapter 6 tab. You should see a visual acuity sheet. Now hear this, and the eyes have it. I want you guys to do the now hear this and the eyes have it worksheets, and make sure you scan that and email it to me. You should also be doing your chapter 5 test in Evolve and your chapter 6 Evolve assignments and chapter 6 study guide questions, and I believe it is going to be the odds on chapter 6. And then if you've not already sent me your results of the chapter 5 study guide, please make sure that you do. And that is it. Any questions about anything? All right, well, if there are no questions, then I'm gonna let you guys go for the day. I will try to get this uploaded to the YouTube channel here in a moment. And as soon as I'm able to do that, I will let you guys know. You're welcome, and I will talk to you guys later. Hope y'all have a good day.